surgical procedure for a bunion, there's many ways to do it because there's different levels at which the bone is deviated. So let me break that down a little bit more. Like I mentioned, that bone starts to move out from the second toe. So as it's moving away, the procedure that's going to be required to get this guy back over here might change, i.e. a head or a middle shaft or at the base. For the most part, at our office we do minimally invasive surgery, and we do a small stab incision at about this level, down to the bone, shave off that bump that's sticking out and it's causing footwear irritation, or the swelling is normally located in that area as well. So we shave down the bone in that area. And then what we do is, because the bone, like we mentioned, is shifted over here, we want to try and move this bone back over to get it repositioned. So then we do another stab incision up at this level to move this bone over. If we have to do a cut in the bone, again, that happens at this level, and we are able to shift that bone over to get it back into alignment. Other procedures, or traditionally, the way that procedure is done is through about a 7 centimeter incision, give or take between 5 and 7 centimeter incision on the top of the foot, go through all the layers of the tissue, get down to the bone, put in screws and plates, close everything up, and then you're kind of out of commission for a couple of months. With our approach with the minimally invasive surgery, you're going straight down to bone through that one incision, and if we have to use a stitch at the end, we'll use one single stitch versus going through all those layers. You have to put the stitches on the inside for the soft tissue and then the outside to keep the skin closed. There's a lot more rehab to it. With the minimally invasive surgery, we're not using any screws, plates, any of that stuff.
And how long does it take?
The procedure itself?
Yeah.
It's pretty, by comparison, because we're not having to put in all that hardware, and it's normally under about an hour or so to do just that bunion. And we do it in our surgical suite in our office. So we're not having to take you to the hospital and get general anesthesia. We do a local block. We give you something to take you into a little bit of a twilight, and then the procedure's performed and you walk out of the operating room. There's no crutches, there's no wheelchair, nothing. You walk out with a surgical boot, and you're in that boot for about 2 weeks. Then you transition to a surgical shoe for 2 weeks, and then we transition you into a sneaker with your custom orthotics, and that's pretty much it, and you move forward from there. So typically we're looking at healing time between 6 to 8 weeks on average, versus traditional looking more like 2 to 3 months, sometimes longer, depending again on the procedure that was selected.